In the world of clinical trials, everything, and I mean everything, rests on one simple thing: trust. Trust in the data. But how is that trust actually earned? Well, today, we're going to go inside a clinical lab to see exactly how quality assurance works, using a case study to really understand the systems that protect both patients and medical progress itself. I mean, think about it. This is the fundamental question behind every single medical breakthrough. The data we get from clinical trials has to be bulletproof. We're not just talking about numbers on a page here. We're talking about people's safety and whether or not new treatments actually work. So, what are the checks and balances that make sure this data is rock solid? To really get how this all works, we're going to follow a case study that's built on the principles of GCLP, or Good Clinical Laboratory Practice. So, let's meet Sarah. She's a quality assurance auditor at a place called Apex Labs, and her entire job is to make sure that every single process and every piece of data meets the absolute highest standard. Let's tag along as she kicks off an audit. Okay, so before we jump into Sarah's audit, let's take a step back and get clear on the mission. What is quality assurance, or QA, actually trying to accomplish in a lab like this? What's the core purpose? Well, it really boils down to two critical things. First, you've got to protect the data. That means making sure every result is accurate, it's legible, it's complete. And second, and this is just as important, it's about protecting the rights, the safety, and the confidentiality of the people in the trial. QA is the independent watchdog that makes sure both of those pillars are standing strong. All right, with that mission in mind, let's get back to Sarah over at Apex Labs. How does she take these big ideas and put them into practice? We're about to break down the anatomy of her audit, step by step. First things first, and this is a really big deal: independence. Sarah cannot audit her own work. She can't even audit the work of her own department. This separation is totally non-negotiable, because it's the only way you can prevent any conflicts of interest and guarantee a truly unbiased review. Now, a proper audit isn't some surprise gotcha inspection. No, it's a very structured process, and it's designed to be clear and fair. Sarah starts with a really detailed plan. From there, she moves into the review phase, where she's digging into the lab's procedures and their records. Everything she finds, good or bad, is documented with absolute precision, and all of that culminates in a formal report for management. So let's get really specific. Here's a little peek at Sarah's checklist for data recording. As you can see, she confirms data entry is accurate. Yep, that's a yes. Record keeping, analyst, and date recorded. Also yes. But look at that middle row. She found a problem with how a data correction was handled. This is what we call a deviation. The original entry wasn't clear, and even worse, no one wrote down why the change was made. And this shows you just how precise an audit finding has to be. Sarah doesn't just jot down data corrected wrong. No way. Her finding is specific, it's objective, and it's traceable. It points to the exact record, 7B45, and clearly states the two things that were wrong. The reason for the change was missing, and you couldn't even read the original entry anymore. This creates an undeniable audit trail. You know, finding a deviation is really just the beginning. The true strength of any quality system is tested by what happens next. So how does this one finding get turned into a formal, trackable solution? Right. So a documented finding like this can't just be ignored or brushed under the rug. It automatically triggers a formal response. So what exactly does that process look like? The process is crystal clear. Sarah's audit report goes straight to the top, to laboratory management. They're the ones who are ultimately on the hook for making sure corrective actions are figured out and put into place, and fast. And QA's job isn't done yet either. They have to keep an eye on things to make sure those actions actually get done. But here's a crucial point. Not all actions are created equal. You see, a simple corrective action might be to just retrain the one person who made the mistake. Okay, that fixes the immediate issue. But ensuring effectiveness goes way deeper. It asks, why did this happen in the first place? A much stronger solution would be to update the official procedure, the SOP, and then retrain everyone to make sure this problem never happens again anywhere in the system. And that brings us to what might be the most important part of this whole quality cycle: making sure the fix actually worked and that it's going to stick around for the long haul. So, back at Apex Labs, management does the right thing. They go for that stronger systemic solution. The standard operating procedure gets an official update and all the relevant staff are retrained on the new process. So, check. The corrective action is implemented. So problem solved, right? Case closed? Well, not so fast. The best quality systems always push one step further. They always ask this critical follow-up question. And this right here, this is what separates a merely compliant lab from a truly excellent one. It's not enough to just roll out a fix. A great quality system has a process to circle back, maybe in a month, maybe 3 months, to actually verify that the change worked and that the problem is gone for good. This all leads us to the final and maybe the most fascinating level of a really mature quality program. This is how you answer that age-old question, but who audits the auditors? Well, in a really solid GCLP environment, the quality assurance program itself gets audited. This makes sure that the auditors, their procedures, their schedules, all of it is up to snuff and is actually doing its job of maintaining quality across the entire lab. And remember, Sarah's audit of that data correction is just one small piece of a much, much bigger puzzle. A truly comprehensive QA program covers everything. We're talking audits of the physical building, the scientific methods, the quality systems themselves, even routine things like how samples are received. It's a whole web of verification that's designed to catch any potential issue, big or small. So, we'll leave you with this final thought. Quality assurance in GCLP isn't just a department or a checklist. It's really a mindset. It's the difference between a culture that just does the bare minimum to stay compliant and one that is hungry to learn from its mistakes and constantly get better. And that dedication to continuous improvement is what ultimately lets all of us trust the data that drives medicine forward.